feel like a nasty, yucky monster.
Wow, she has a lot of added weight on her, and she's such a young woman. One of the things that we don't realize is people who aren't carrying so much weight, just the added problems that that weight can have, and how difficult it is just to stay clean as what you're seeing here.
Sometimes I feel so hopeless. And I think that maybe it's not worth it.
So you may look at her legs and say, what is going on with them? Is that just all excess fat that she has in her legs? And the answer is not necessarily. She appears to have severe lymphedema. And lymphedema is what can occur when you have excessive weight, that it can actually block your lymphatic channels and it can cause fluid to build up in parts of the body. Believe it or not, one of the names for this when it's really severe is elephantiasis. Not a very nice name for it. And this can happen when sometimes elephantiasis is not so bad, and other times it can be so huge that people can't walk when it's that big.
I have a lot of anxiety and I don't like it. I don't have to think about the way I let those around me down if I'm eating. It's a distraction.
It's easy for people to judge somebody who is massively overweight like Amber, but what we don't know is why is she this heavy? And it appears in Amber's case, which really you see in a lot of people who have a lot of weight like her, is that there's emotional eating involved. There are issues, like for her it could be anxiety, where the comfort comes from eating food. And there is so much that can occur in how we grow up, in how our parents treat us, and the things that people say to us that can really impact how you feel and how you act and how you eat as an adult.
You are almost 660 pounds.
Mm-hmm.
What seems to be your biggest challenge with your eating habit?
I overeat. I have a hard time walking because I can't get my feet together. I have a really hard time just with the way my weight is stored. Like, it's down here and here.
So you can see how her proportions are different than what you probably are used to. And believe it or not, that elephantiasis, that lymphedema that she suffers with, is something that can also occur in third world countries due to parasites. People can have this happen to them not necessarily by being overweight, but by worms that are spread from mosquitoes, believe it or not. The hope in Amber's case is that if she can lose some weight, either by reducing her emotional eating or by having surgery by Dr. Now, not only will she lose weight due to fat reduction, but she may lose a lot of that fluid that has accumulated into her legs, allowing her to be able to move more and to be more active and to lose even more weight.
We can only help people that are able to comply with it. Amber is surrounded by enabler with her family. I want to see some weight loss from her before I even consider her for any kind of surgery.
Whenever somebody gets as large as Amber, there often is a component of enabling. And what that means is oftentimes members of the family, spouses, people who live with them, who take care of them or help take care of them, will give them food that maybe they shouldn't, will enable them to do things that maybe are not good for their health. And so what Dr. Now is saying is that for this to be successful, for surgery to be successful for her, there has to be changes not only in what Amber does, but in what her parents do and how they treat her.
I haven't been on a scale since I saw the doctor last month. I know I've made good progress.
Good, Amby.
Everything seems like going in the right direction. You have lost enough weight and you're ready for surgery.
Good for her. By making some changes in how she eats, she's lost 17 pounds in just a couple of months. So that's a great start for her. But where she's really going to get big changes is after this operation.
Amber is having her weight loss surgery today. Gastric bypass is a very effective tool for weight loss. We're going to change the digestive system.
So what happens during a gastric bypass? Well, essentially you bypass portions of the stomach, and the small intestine. And so the idea is that you make a small stomach pouch. He mentions the size of a baseball. I've also heard the size of a golf ball. It gets pretty small. And then you actually reattach it lower down into the small intestine. And by doing that, a person can get full quicker, so they don't eat quite as much. And the second thing is that you bypass some of the digestion, and so you allow the body itself not to quite digest as many calories.
Everything well fine, and we finished the surgery. We're gonna go ahead and move her to recovery room.
Back when I used to do these in my training, we would do these open, where we would literally make an incision all the way down the tummy and do this under direct vision. You can see here he's using a laparoscopic technique, and that's what's used across the country now to do gastric bypass surgery. The other option, other than gastric bypass, is gastric sleeve surgery. This is a little less invasive. You don't lose quite as much weight quite as quickly, but that's another option.
I'll carry my purse and I guess the backpack if you want me to. I know I have a lot of work ahead of me. This isn't going to be easy. I'm going home to a different world.
Recovery after a gastric bypass surgery is not nearly what it used to be when I would do them in an open technique. But what is still difficult is the eating part of it. So the actual surgery, you heal pretty quickly, but you have to start eating in such small amounts, in literally teaspoons with clear liquids and then advancing it, that it can be very difficult for some people. Now, on top of that, she is dealing with emotional eating issues. And we all know what emotional eating is. I think we all probably do some emotional eating on our own. You know, how many times have you felt a bit down, or maybe you had a bad day, or you were tired and you said, I'm just gonna reward myself with a little bit of ice cream, or I'm just gonna have some chips, or I'm going to eat a slice of cake because I just want something to feel good. That's what she's been dealing with, but on a much bigger level than what a lot of us who may not be her size and have her issues with it have. But it really is all on that same spectrum. And I think that's a really important point to make, because we should all have empathy for her, because her emotional eating isn't necessarily all that different from maybe yours or mine.
Since surgery, I've dropped quite a bit of weight, and my legs dropped a lot of fluid really, really fast.
That's that lymphedema that I mentioned earlier, and that's great because as her weight comes down, those lymphatic channels start to reopen and they start to clear that fluid. Hopefully her legs are going to get even smaller very quickly for her.
I've been working hard over the last months, not just to eat better, but to do more.
It's great, right?
Yeah.
Good job.
Wow, that is such a huge accomplishment that she's made. Now, it isn't uncommon for people with gastric bypass surgery to lose upwards of 70% of their extra weight in the first 18 months. Doesn't happen to everybody though, and so the fact that she is down over 250 pounds, that is awesome for her.
I see you lost some more weight. I'm glad to see that you're making good progress.
I've come such a long way, and I still have a ways to go. But I'm gonna get there. A year ago, I'm not sure I believed my life would ever get any better. Life is totally different for me now.
What a great story, and she shows that if you just take your life in your own hands and make some changes, that you can really change your life for the better. So I hope that if you're watching this and if you're dealing with your own issues, whatever that may be, that she inspires you to take your life into your own hands and make it for the better.
Most days, I don't even want to get up.
I'm in a lot of pain. It's a nightmare that I want to wake up.
Wow. When you have so much added weight, it can create changes and problems in other body parts. Some people think that if you have added weight, it just makes your joints hurt. But you can develop issues with infections under your skin folds. As you can see, she has some lung issues potentially due to her excessive weight, causing her to be on oxygen.
Some days I want to die so they don't have to take care of me anymore.
When you are as big as Laura is, there are a number of daily activities that you or I may take for granted that they cannot. Simple things like washing parts of your body, even wiping after you go to the bathroom, can be very, very difficult for them. So I really hand it to her family that they help take care of her. The question is are they helping to help her lose weight and to improve her condition, however?
I have a big family and we all love to eat. And I just can't stop. I want to change, but I'm scared that I won't make it.
A few things to take away from what we're seeing here. The first thing is the types of foods that she's eating, at least here, are not foods that are good for keeping your weight at a healthy level. Foods like ice cream, which is dairy, not good for you, filled with sugar, also that can contribute very quickly to weight gain, plus the fried foods and the processed foods, which are so bad for you and can also cause your body to gain weight like this. And two questions that I would love to answer is, does she have a food addiction, and is she an emotional eater? Because these are two big things that you can often see in people who gain a lot of weight.
Doctors have told me that they're just giving me medication so they can make me comfortable so I can go ahead and die already.
What? What kind of doctors are these? Give her medication to help her die already? She has some major issues, don't get me wrong, but why would somebody give up on her? As doctors, we're meant to help people get better, not help them to die.
What seems to be your biggest challenge with your eating habit?
Sweets. I'll try to find anything sweet.
So where do you get that cake? Who? You?
It's a tough position for somebody to be in when you've got a loved one who is so overweight, but they gain so much satisfaction and pleasure and joy from eating food. So you want your loved one to be happy, you want to bring joy to them, but what if that joy is literally killing them?
To do that, you're gonna have to change your eating habit. Frequency of eating is gonna be only 3 times. There'll be no snack in between the meal. And I need you to lose 50 pounds over the next couple months.
Some tough love from Dr. Now. Essentially, he's telling her that if you don't lose 50 pounds, I'm not going to do the surgery on you. And this is super important because you may have heard stories of people who undergo gastric bypass surgery. They have bariatric surgery, they lose a bunch of weight, but then they gain it back. These operations are not foolproof. You can eat through these operations and gain your weight back if you haven't fundamentally changed your lifestyle and what you eat and how much you eat.
Joey's been really supportive. Sometimes I just want candy or cake, but he brings me good stuff now. So whatever it takes, I'm willing to do it.
There is a fallacy that if you eat fat, you're going to get fat. And that actually is not necessarily true. Where people gain a lot of weight is not necessarily by eating too much fat, but it's by eating too much sugar. And so you hear about her talking about candy, about cakes. This is all sugar that causes you to gain weight. So the sugar will actually convert to fat in your body. So what you're seeing her eating here is a fairly low-carb diet. The carbs that she's eating are healthy carbs like vegetables combined with good protein and healthy fats. This is a recipe for weight loss.
We're at the doctor's office again to see if I qualify for surgery. Oh my gosh.
This is an awesome accomplishment for her. She's lost over 50 pounds just by changing what she ate. And did you notice she doesn't have the oxygen anymore? So because she has dropped that weight, she's gotten healthier, she's been able to get rid of the oxygen, and she is breathing much better. Next step, surgery to really take that weight off.
Nora is having her gastric bypass today. This is a risky operation for a patient this size. We have to be careful to make sure that surgery is not going to compromise her respiratory status.
Even though Dr. Now is performing this operation laparoscopically, so it's minimally invasive, it's still surgery, and there even is a risk of death. Now, the risk of death is less than 1%, but there are other risks when you operate on somebody this large. The first thing that comes to mind is a pulmonary embolism or blood clots. Those can go from the legs to the lungs, and especially in somebody like Laura, where she's had some lung issues in the past, it could be very, very dangerous.
This is not good. Laura has very large liver that could cover upper part of the stomach. That makes it very difficult to do gastric bypass.
The liver is on the right, and it contains multiple lobes. The spleen is on the left, and in between is the stomach.
It looked like it's impossible to do a bypass. We have to convert to a sleeve gastrectomy.
If you don't have good access to the stomach, a gastric bypass is very difficult to perform because you have to do a couple of anastomoses, meaning you got to cut the stomach away from itself and you have to reattach it. And that can be a very difficult operation when you've got the liver and the spleen in your way. So what's the difference between a gastric bypass and a gastric sleeve? During a gastric sleeve, you don't do the rerouting of the stomach and the intestines, you just make the stomach smaller. You cut away a part of the stomach, making it look literally like a banana. Because you've got a smaller stomach, you eat less, but because you haven't rerouted the intestines, you don't lose weight quite as quickly, or maybe not quite as much.
My hunt for the secrets of healthy and glowing skin have all led me here, and I aim to find out why. I'll get to the bottom of this skincare mystery.
There's no mystery here. It's just Youn Beauty. Our products are packed with all the necessary ingredients that you need to help hydrate, protect, and revitalize your skin. It's really just that simple.
There's no way it's that simple. I'm on to you, bub.
Check out our online store at younbeauty.com or download the Youn Beauty app on your phone to order yours today.
This surgery will still help her, but not as much as a full bypass.
So how does somebody decide whether they should do a gastric bypass or a gastric sleeve? Well, it really depends on the doctor and the patient. A bypass does have a bit more of a complicated nature to it. You also have potential risk of nutrient deficiencies that you don't necessarily have with a gastric sleeve. For that reason, in my practice, I've seen more and more patients come in who've had gastric sleeves. It's kind of like the popular treatment today. But the question in the end, like the old gastric lap band that we really don't see much anymore, does that weight stay off like it would with a gastric bypass?
But I still have cravings. I've been throwing up a lot because I'm eating more than my stomach can hold.
After a gastric sleeve and a gastric bypass, you are forced to change how much you eat and even what you eat. And one thing that can happen more in gastric bypass than in gastric sleeves is dumping syndrome. Dumping syndrome is a constellation of symptoms that some people can get when they eat too much, too fast, and especially if the food is too carb heavy after these operations. You can get cramping, you can get diarrhea, you can even get dizziness from this dumping syndrome for eating not the right foods after these operations.
I'm starting to do a lot more for myself. I want to become as self-sufficient as possible.
Nana, what are you doing?
I'm cooking.
This is so great to see because not only has she changed what she's eating and eating healthier foods that are going to help to sustain a healthy weight for her, very different than what we saw earlier in the program, but she's actually making it herself. And I think for some people that's a really big step for them because now they can take control of what goes into their mouth and they can actually get the credit for that weight loss.
I'm so happy about today. It's been so freeing and so liberating. It feels like everything is starting to come together.
I'm really excited to see what the future lies for her.
You gotta bring that toilet over, babe. I'm embarrassed of my body. I don't want anybody to see it.
So what's going on with Charity? Well, at 778 pounds, this is not just a simple case of somebody who is significantly overweight. She appears to have a very extreme case of lymphedema. Lymphedema is a condition where you get blockage of the lymphatic channels, and this can cause the body to swell up. Sometimes the swelling is fairly modest, other times it can be massive swelling, like I think we're seeing here with Charity.
I mean, I look completely different than anybody else, so. But when I see myself in a mirror, I feel like some monster.
So what really is going on here? Why are her legs so absolutely massive? When lymphedema becomes really severe, it can turn into a condition called elephantiasis. Elephantiasis is a not very kind term given to when the body's lymphatic channels become so clogged up that the body starts to swell, sometimes to massive proportions. Not all of what you're seeing here is actually fat, but some of it is just lymphatic fluid. It's like water in the body that does not have a path to escape. One of the main causes is excessive weight. So we're seeing that more and more here in the United States. But in other countries, especially countries like in the Caribbean, in South America, in the Pacific Islands, elephantiasis can be caused by parasites, like actually worms. There are certain worms that can actually lodge into your lymph vessels and your lymph nodes, clogging them up, causing these body parts to expand excessively. And how do you get these worms? You get bitten by mosquitoes.
I have to make sure I stay clean everywhere because I have open sores that can get infected. My body is literally falling apart. I just never dreamed my life could get this bad.
What are those big, massive things on her back? Those appear to be called massive localized lymphedema, and they're kind of unusual, but there are these lymphatic growths that some people can develop. This type of weight, especially when it leads to this type of lymphedema, can lead to infections, and that can actually cause somebody to die from it.
We have to intervene now, or she's not going to survive much longer. You're going to be on a strict diet, about 1,000 calorie, high protein diet, low carb, and no outside food.
So why is the doctor admitting her to the hospital? I mean, she's been living like this for a while. Being this much overweight can lead to many other issues with your heart, with your lungs, with other body parts too. But where I think that there's an immediate risk is infection. Now, we do know that losing weight can help improve elephantiasis. Also, losing weight will help her become a better candidate for future surgery.
Today, Charity is having a bypass surgery, and we got her down to 650 pounds, so she's ready for surgery.
This is definitely a risky surgery, especially in somebody at her weight of now 650 pounds. But the risks of the surgery are definitely less than having her continue to live like this, where she is at high risk of a very early death.
Usually, stomach is as big as a football, and with the gastric bypass, we make it as small as a baseball.
So technically, what is a gastric bypass surgery? Well, put simply, a gastric bypass surgery is where you remove the majority of the stomach. And he said it was the size of a football initially, bring it down to a baseball size, and some doctors even bring it down to the size of an egg. And then what you do is you reroute the stomach to the small intestine, removing basically, or taking out of the equation, the majority of the stomach and the early part of the small intestine. What this does is it makes the stomach obviously much smaller so that people don't eat as much and they're full much quicker, and it helps to bypass a part of the small intestine so you don't absorb the food quite as much. And this leads to very quick and usually sustained weight loss.
They want me to get up and walk a lot because if I don't move, I could develop a blood clot from surgery and it could kill me.
It is so incredibly important to walk after surgery. And that's because when you're under anesthesia, the veins in your legs do not move the blood and they become somewhat static. The only way for the blood in the veins of your legs to actually move is if your muscles actively contract to move that. And because you're asleep, that doesn't happen. So it's incredibly important after surgery to walk and to flex those muscles in the legs to get that blood flow going to prevent blood clots.
Today we're going to see Dr. now and see if I qualify for skin surgery. But I need to be around 600 pounds if I'm going to get the surgery.
This surgery will help Charity a lot.
It looks like the doctor is going to now tackle the massive localized lymphedema, those two large masses that she has kind of on her side and her buttock area. So taking these off can provide multiple benefits for her. She can become more mobile, which can help her lose more weight. They can also reduce her risk of infection, and they can hopefully help her feel better about herself.
Today we're doing the skin removal surgery on Charity. We have to get these masses by making large incisions.
This is a massive operation where you're taking these huge areas off of a person. By taking off all of this water, it can cause fluid shifts in the rest of the body, and that's something that they need to watch really closely. And also by taking this off, now you've got new wounds that you've created. Now granted, they're clean surgical wounds, but they can become infected. If they get infected, she can die from it. If you're dealing with hyperpigmentation, age spots, and other blemishes, check out my Youn Beauty Brightening Cream. It's filled with natural skin brighteners like kojic acid and licorice root extract. It's fragrance-free, cruelty-free, and it really works. Check it out at younbeauty.com. There's a link in the caption below.
Water. We lost a couple dozen cc of fluid from it.
How incredibly satisfying would it be to remove these huge masses off of her? I mean, and to carry that and to set it aside, that's one of the best things, honestly, about being a surgeon. When people are excessively large, their blood vessels can actually enlarge in size because they have to try to pump blood to these organs and these parts of the body that are very, very far away from the heart. This will increase your risk of a lot of bleeding during the operation. And the other thing he mentioned is that there's 2 to 3 liters of fluid that was just removed while you're trying to take this out. It's like water that is sitting in these structures that is also going to basically gush out when you start removing it. Wow, 57 pounds. The most I have taken off of a patient is probably about 35. So over 50 pounds, that is crazy.
It's just been incredible moving around without these weights on me. That's a lot.
Hi, you ready to go home?
It's just amazing.
It's going to be a whole new life for her.
Kudos to Charity's doctor for taking this really difficult case on, and kudos to Charity for making these changes in her life. Now, she does have a long ways to go, but I have faith that she's going to get there and lead a long and healthy life.
I go to bed hurting, and I wake up hurting. My knees, sometimes they buckle on me. That's why I use a walker.
Having this much excessive weight can cause so many other difficulties, not only with your heart and with your lungs, but with your joints. I mean, it can be very difficult for people of this weight just to walk around their house.
In gastric bypass operation, we create a small stomach to help patient to lose weight. And
during the surgery, basically you take a stomach that's about the size of a football and you reduce the size. You basically cut out the excess and make it the size anywhere from an egg to maybe the size of a baseball. And what this does is it allows the person to get full much more quickly than they otherwise would. And the other part of a gastric bypass is that you take that little stomach and then you bypass a portion of the small intestine, attaching it lower down. And this causes less absorption of the food and helps also with losing weight.
Patients that are extremely overweight, there are a number of difficulties you can have.
Now, back when I trained in general surgery, and this was almost 20 years ago now, we would do gastric bypass surgeries under an open approach, where we would literally make an incision straight down the middle of the tummy and get into the abdominal cavity and do the operation that way. What they're doing nowadays is they're being able to use 5 small incisions. They then inflate the inside of the abdomen with air, allowing the surgery to be done through actually using remote scopes and instruments. And you avoid then that big scar down the middle, and you avoid a lot of the potential complications and the horrible recovery some patients would have after an open gastric bypass.
If anything goes wrong, it will be very difficult to pull this patient through.
When you are so large, your heart has to work overtime and excessively hard to pump blood to all the different body parts. On top of that, when you have surgery, that also adds to the strain on the heart, and that's why some patients can get heart attacks during or after an operation. So this is definitely a very high-risk surgery, but in somebody who weighs as much as he does, I think it's worth it.
The one thing that I was afraid of most of all was I wouldn't wake up again.
It's interesting because I hear this from my patients all the time. My patients tell me the thing they worry about most is not necessarily being disfigured from the operation or having a bad result, but they worry that they're going to not wake up from anesthesia. The good thing is that our anesthesia nowadays is so much safer than it ever was before. And the chances of developing an actual problem like that, never waking up, is extremely, extremely tiny.
Henry is doing extremely well. I expect he's going to lose 500 pounds in 2 years' time.
Studies do show that after gastric bypass surgery, patients tend to lose approximately 70 to 80% of their excessive weight within the first 18 months. For some, this can lead to a lot of loose skin, which is something that plastic surgeons like myself help take care of.
Ta-da! Like my mom,
It's a very difficult diet that patients who have gastric bypass have to follow in order for them to be successful in their weight loss. It literally starts with tablespoons of clear liquids, progresses to pureed foods, and eventually regular food. But the problem is that if you eat too much, you can stretch, even a stomach that has gotten really tiny, you can really stretch that out and people can gain their weight back.
483, that's good. That's better than what I thought it was going to be. I hope to be scheduled next month for my first SS skin operation.
That's great. He has lost a lot of weight, and what that allows him then to do is to undergo the skin operation, which is essentially called a paniculectomy. Now, a paniculectomy is a surgery where you remove the pannus. A pannus is a large amount of excess skin that hangs from the tummy. It's not the same as a tummy tuck because it doesn't include muscle tightening and a lot of the cosmetic elements of it, but it can definitely help improve the quality of life of a patient who's had a ton of extra skin.
Sometime tomorrow, he and my foot will not have this lower part of his stomach no more.
He's showing us his pannus, and this is removed once again by a paniculectomy. And the benefit of that is going to be two things mainly for him. First thing is those can be quite heavy. I've removed in my years as a plastic surgeon anywhere from 25 to 35 pounds off of somebody from their pannus, from that area. And if you can imagine just walking around with a 25 to 35 pound weight hanging from your tummy everywhere you go, and then imagine having that for years and years and years and then having it removed, how great that would feel, and it really does. The second thing is that the skin underneath the pannus can become excoriated, it can become infected, you can develop sores under it, and even fungal and bacterial infections. And so it is a medical procedure to remove it.
He has a lot of excess skin, lower abdomen that we're going to take off.
It's all done and over.
Is that satisfying to remove so much skin from somebody? Oh, heck yeah, it is. It feels good not only for the surgeon to remove it, because it's so satisfying just to take that and lop that off, but it's also satisfying, obviously, for the patient to get rid of that.
404.2. You're walking like a champ.
Okay, let's see if we can get you laid down.
Those little dangly things are drains, and we use them after surgery to drain out any fluid that can develop. Whenever you have surgery, your body will create this kind of inflammatory fluid, kind of like the fluid of a blister. And if you don't remove it, it can build up and it can kind of slosh around on the inside, hence the drains.
I need you to get in the shower and get the soap and water and wash the incision gently.
Patients who are this large have a much higher risk of infections and wound breakdown.
Doesn't he look great? He's smaller now than he was when I first met him.
Long life and happy day.
Yes.
And that may be the best part of all of this, is that having this surgery and undergoing the changes that he did appears to have caused him to actually like delicious, healthy foods. And I hope that he continues on this course. There was a woman recently